Hello, my name is Rika and I'm a third-year nursing student. I'm here to demonstrate PCA administration for morphine. So I got my doctor's order, my MAR here. I got my patient, Paris Marcy, PHIN numbers 1, 2, 3, 4, 5, 6, 7, 8, 9. And the patient has no known allergies. The medication we have is morphine, 1 milligrams per ml. And so that's the right medication. And we got PCA dose, 1 milligrams. The usual is 1 to 3 milligrams IV. And that is an IV, so that's the right route. So we got the right patient, right medication, right dose, and right route. Lockout interval is 5 minutes. It says 5 minutes here, so that's the right time. And it's due now. It also checked that it is signed at the bottom by the doctor. And I also checked the policy for this medication as well. So now I'm just gonna go take a look at our PDM. We got a medication, morphine sulfate, and morphine is right here. It's a highlight medication, so we know it's a 2-nurse check. And it can be given by PCA, and it can be given by a student nurse according to the policy as well. So I can give it. So the medication must be reviewed and reordered by the physician every 7 days. We check that as well. And the PCA for that will be the safe dose for that would be in the physician's orders, which we already checked is the usual 1 to 3 milligrams as well. So we are in the safe range. So what we're going to take a look now is the compatibility of this medication. Is compatible for normal saline, which we know is already running at the bedside as the carrier infusion. We also check the potential hazards such as respiratory depression, dizziness, nausea, and vomiting. And we're going to monitor the patient's pain relief for this as well. So we're also going to check the stability for this one, which is 24 hours at room temperature. So now what we're going to take a look at is the recipe for this. So we have an order in the MAR as well that the morphine must be 1 milligram per ml as the final concentration. We're looking here at the PCA recipe with the 1 milligram per ml final concentration. So we're using this exact recipe. So we need to draw 50 milligrams in the syringe. So and then we need a 45 ml normal saline. Because we're doing a Curlin, we can just leave the 45 ml in this medication bag or in the normal saline bag. We also made sure that it is normal saline and 50 ml. So wash my hands again. Now I have my syringe right here. Open that. While maintaining sterility, I have my blunt fill needle right here. While maintaining sterility, I'm gonna put that in there. And I have my alcohol swab. Gonna clean it for 30 seconds, let it dry for 15. And I'm gonna drop my 5 mLs. So nothing touched that port so I can access it. Just gonna take my 5 mLs right here. There we go. Gonna take out the excess air bubbles. What's the time?
2 minutes 44 seconds.
Okay. So I'm just gonna put that in there. I also checked my patient's vital signs for this prior so that I'll know that it is appropriate to give this medication to them and their pain level as well. So I got my 5 mLs right there. So we're good. I don't see any air bubbles as well, so we're good. And now, that means we have 45 mLs in here, which is exactly what we need. I'm just gonna label this as well as the excess normal saline. And that is the 5 mLs so that I don't confuse it with anything else. Just gonna put that in there. There we go. I'm gonna put that aside for now so we can check it later. So now I'm just gonna do the labels for this one. So our patient is Marcy Paris, and the drug name is morphine. The dose for that, according to our PDM, the total dose in the bag would be 50 milligrams. The volume would then be 5 times 1 ml, would be 5 mLs. And the diluent is 45 mLs normal saline. And the concentration per ml is 1 milligram per ml, which is exactly what we need. The date and time is today and now. And the signature is my initials. We also made sure that according to our MAR right here, our bolus is 1 milligram. There is no continuous infusion for that. And I also checked the lockout, which is 5 minutes. Okay, so now we put that on our bag. There we go. And now we drop our medication. So we have our syringe right here. How much time?
15 minutes and a half.
Okay, so I'm just gonna open this up while maintaining sterility as well. There we go. And so for demo purposes, I'm gonna use a blunt fill needle as well. But in reality, we will be using a filter needle. It's just we had trouble with the blunt fill filter needle before in the demo. So we're just gonna use a regular blunt fill instead of a filtered one. Okay, so I washed my hands already. I'm just gonna make sure, prior to drawing up my medication, I made sure that each one of these are morphine at 10 milligrams per ml, and I made sure of that as well. So 10 milligrams morphine, 10 milligrams per ml morphine, morphine 10 milligrams per ml, 10 milligrams per ml morphine, 10 milligrams per ml morphine. I also checked they're not expired as well. So I'm just gonna drop my medication. Just gonna take that right so. And we're making sure that we're only touching the end part of the syringe, or the plunger, sorry, so that we're maintaining sterility as well. So I'm just gonna take out that. There we go. Just gonna take out the excess air. And we need to make sure that we have 5 ml in total here. There we go. Just gonna take that out. Okay, so we got 1, 2, 3, 4, and each of these contains 1 ml, so it has to have 5 ml in here. Just gonna make sure I have correct one. I'm just gonna recap that for now while maintaining sterility. Okay, just gonna take out the excess air bubble. I have some excess, so I'm just gonna discard that as well. So right here, the med waste container, I'm gonna take out the excess, and we got our 5 ml of morphine right here. So now I'm gonna label that as well. So morphine, and it is 50 milligrams and 5 ml, just so we don't confuse it with anything else. There we go. So I got my label, and now I'm gonna do my second check as well as my normal saline right here. So I got my patient, Marcy Paris, and the medication is morphine. All of them are morphine. I've already checked. So morphine, and there are 1 milligrams per ml is the final concentration. I got 1 milligrams per ml is the concentration final here. So according to our PDM as well, that is the recipe that we followed. So we need to drop 50 milligrams of medication, and that would be 5 times of the 10 milligrams per ml. I checked that they're all 10 milligrams per ml in here, and so we have the 50 we should have 5 ml in our syringe right here. So we have 5 ml, and so we also have to have 45 ml of normal saline. We have already drawn up our excess normal saline here. It says 5 ml, so we know that there is only 45 in the bag, and when we combine them all, we will have 50 ml in final volume and a final concentration of 1 milligrams per ml. So now I've already checked the right dose. It's a PCA, so I know it's an IV. It's a mini bag. It says IV here, so it's the right route. The time is lockout interval is 5 minutes. It's due to be changed now, so that's the right time as well. So I got my right patient, right medication, right dose, right route, and the right time as well. So now my second is gonna check that. They checked it, everything's okay, and now I can inject the medication. I'm making sure that it's the morphine. So the normal saline goes to the waste and the sharps container as well. So I'm gonna clean this up. I'm gonna clean the port. Need time?
11 minutes and a half.
In?
Yeah.
Okay, so now it's already cleaned. It's not touched with anything. I cleaned it for 30 seconds, I dry for 15, and now I can inject it and make sure that this is the morphine. There we go. And I shouldn't be waving my needle like that as well. There we go. So this goes to the sharps container. I'm just gonna tilt my bag right here to make sure that everything is in the bag diffused properly, and all of this goes in the sharps container as well. So now I'm ready to go to my patient's bedside. I will be bringing my mark. I'm gonna wash my hands as well. So these goes to the side. I'm gonna make a label for my tubing as well. So morphine, and that would be the time today and the date, and I will sign my initials in there as well. So now we go to the patient's bedside. We wash our hands, we do our safety check. Patient's not in distress, bed's in lowest position, no safety hazards, and no fluid come in. So hello, my name is Rika and I'm your nurse today. I'll be giving you morphine. This is your pain medication. Before I do that, I'm just gonna check your wristband right here. Can you give me a full name? Okay, Marcy, Paris, can you give me your, how old are you? 55 years old, that's what we have here, so don't have any allergies. The patient doesn't have any allergies, so we're good. So, just like I said, this medication is morphine. This is gonna help with your pain. And this one, so you usually have it in this bag. We already monitored your vital signs for this. It's stable, it's appropriate. And we're giving this medication because you just had surgery, you're in so much pain, and we want you to be in control of your pain management. So do you have any questions about that? Is it okay to get this medication? Patient consented, so we're good. And now, I'm just gonna, sorry, how much time?
10 minutes.
10 minutes? Okay. So now, I'm just gonna do my third check. So I checked that it's the right patient. So I got Marcy Paris, MP, and we got our dosage, our label for the tubing as well ready in here. And now, so we checked the right patient. That patient doesn't have any allergies. They consented. Medication is morphine, right medication. And we got 50 milligrams in here. Volume is 5 mLs. And the diluent is 45 mLs normal saline. There is a 50 ml total volume in here, which means we have a concentration of 1 milligrams per ml, and that is exactly what we need here, so that is the right dose. The patient's dose bolus would be 1 milligram as ordered by the doctor, and we also made sure that we wrote that in here as well in our label. Okay, so now we check that we have the right patient, right medication, the right route, which is PCA, and it's an IV, so that's the right route. We also have the right time, which is 5 minutes as the lockout interval, and it's due now. So I got right patient, right medication, right route, right dose, as well as the right time. So now we're gonna set up our pump. We made sure that there is a carrier line running at 2 kVO. We made sure that it's not clamped as well. So I'm just gonna wash my hands again. Okay, so now before I change the tube, I'm just gonna program the pump, and we will be comparing that with our MAR and our med label. Time?
Yeah.
Time?
8 minutes and a half.
8 minutes? Okay. Okay, we're just gonna wait for this one. Okay, so program, yes, and the code would just at the back, so that would be 94629. It's just backwards. 94629, and there we go. So we made sure that the unit is correct. It's milligrams. It's milligrams in here as well. So hit yes. And the concentration that we need is 1 milligrams per ml, and it also says 1 milligrams per ml in here. So that is correct. So we're just gonna put 1 in here and put yes. Enter. We're doing it via IV, so we're doing it IV. Loading dose, we don't have any in our order. We're checking here as well, so we're good. So we just hit yes. Okay, so the med limits, we wanted to stay off as a safety feature, so hit yes, and next yes. Okay, so the bag volume, we know that there's 50 mLs in here. We checked, so there's 45 mLs in the diluent and 5 mLs in the medication. There's a total of 50 mLs, so we need 50 right there. The basal rate, we don't have any. We're checking in our MAR as well. We don't have any order, so we're leaving it at 0. The bolus dose is the one that we have in our order, which is the 1 milligram. We have 1 milligram right there. And we also have 1 milligram bolus in there, so that's correct. So the bolus interval would be the lockout period, which is the 5 minutes. Just gonna put 5 minutes in there. Okay, so we made sure 5 minutes. It's 5 minutes in here. And the bolus is per hour, is the amount that the patient can have. The amount of bolus the patient can have in an hour. So that's going to be 60 divided by 5 means it's 12. So now I'm just going to hit enter as well. So I'm just going to hit yes. And my second nurse will do their independent check. And now they confirmed everything is correct. So that's good. Now I can change the bag. And I'm going to wash my hands again. Now I'm just going to make sure that it is connected to the patient. And this line is also unclamped for now. Okay, so, and it's connected right here as well. And we're using a no-port tubing and the micro tubing for this Curlin. So, just gonna change this while maintaining sterility. Okay, so this goes to the garbage. And I'm holding it like this so that it doesn't touch anything else. While maintaining sterility, I'm just gonna spike the bag. And I'm gonna hang it. So the protocol for a PCA would be we'll be checking the patient's vital signs every 4 hours, and we already did that as well. So now we're gonna lock it, close it, and we're gonna hit run right here. So there is the green light in there, so we know that it is working. And we make sure that everything is unclamped because it is running in TKVO, so we can really visualize the 3 drips in there. So we make
5
sure
minutes.
everything is unclamped. So, and the patient has the PCA button right here. So, Ms. Paris, this PCA button right here, this is your PHIN button. You can push it every 5 minutes, and it's only you can push it, not a nurse, not your family members, just you. And it's a safety feature because we don't want you to get overdose for that. Is that okay with you? Okay. So, and your call bells right here. If any of those side effects happens, the dizziness, the headache, shortness of breath, definitely let me know. Okay, so I will be documenting on my MAR as well. So I'm going to put the initiation time, as well as my buddy nurse or my second nurse will be co-signing in there as well. And then I'll do my safety check, patient's not in distress, that's the lowest position, no safety hazards, and I will exit.